Good afternoon, everyone, and welcome. Manitoba Start is the leading provider of career services to newcomers in the province of Manitoba and connects businesses to a world-class workforce. I would like to welcome you all to this Labor Market Connection webinar, a series of live broadcasted events designed to assist you in entering the Manitoba labor market. To begin with, Manitoba Start operates from Treaty 1 territory, the traditional land of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene people, and homeland of Métis people. We acknowledge that our water is sourced from Shoal Lake 40 First Nation. Acknowledging this truth is important, yet only a small part in cultivating strong relationships with Indigenous communities. Today's webinar is focusing on the nurses, CLPNM and CRPNM. My name is Eda Can. I am Labor Markets Connections Coordinator here at Manitoba Start, and I will be your host for today's webinar. Given the large number of participants who joined this webinar, we have muted your microphone to allow for better clarity and less interference. Before we begin, I will be going over a couple of housekeeping items. You can use the raise hand feature to indicate that you have a question or comment. To do this, you can click on the Participants button in the meeting controls and find the raised hand icon next to your name and click on it. This will notify us that we have a raised hand. Teams webinar provide a Q&A feature that allows attendees to ask questions specifically in the Q&A panel. To access this, click on the More Options, 3 dots button in the meeting controls and select Q&A. You can then type your question in the Q&A panel. Before I introduce our presenters for today, I would like to run a few polls to get to know you better. So the first poll asks, are you registered with Manitoba Start? Yes or no? I will give you a moment to answer. "100% said yes. And on our second poll today, do you need help with a resume, cover letter, or interview preparation? Yes or no? Again, I will give you a moment to answer. "100% said no. That's great. And on our third poll for today, where are you joining us from today? Northern Manitoba, Southern Manitoba, Winnipeg, outside of Canada? I'll give you a moment to answer. Winnipeg. And on our last poll for today asks, what is your reason for attending this webinar? Are you an internationally educated professional, settlement worker, career coach, or other? Again, I will give you a moment to answer. Internationally educated professional and other. Thank you everyone for participating in the polls.
Ada, sorry to interrupt. Something went wrong. But yeah, I want just to let you know all that I am the French translator for Manitoba Start. So bonjour tout le monde, je suis Rabha Mazer. Je travaille pour Manitoba Start en tant que traductrice en français et je serai ici pour vous aider avec toutes vos questions. So, merci et bienvenue encore.
Thank you, Rabha. And today, the webinar is with the nurses. The CLPNM is the professional regulatory body for LPNs in Manitoba. The presentation will cover the Manitoba licensed practical nurse pathway to registration. Over to you, Kathy.
Thank you very much. Okay, let's bring this up here. Ada, can you see the presentation?
Yes, I can.
Okay, perfect. Thank you. All right. So yes, my name is Kathy Halligan. I am the registration consultant at the College of Licensed Practical Nurses of Manitoba. So thank you for inviting me today. I am going to present on the Manitoba Licensed Practical Nurse Pathway to Registration for internationally educated nurses. So the practical nursing profession is a self-regulating profession. The privilege and responsibility of self-regulation has been granted by the government on behalf of the people of Manitoba. The authority to regulate the profession comes from the Licensed Practical Nurses Act, the regulations, bylaws, and policies. The College of Licensed Practical Nurses of Manitoba has been regulating practical nurses for over 75 years. And our mandate comes from the Act, which is to serve and protect the public interest. As LPNs are not known around the world, and to set a little bit of context, I will quickly discuss the LPN scope of practice in Manitoba. When compared globally, LPNs in Manitoba have the deepest and broadest education and scope of practice. Most countries do not have licensed practical nurses, and those jurisdictions that do have LPNs do not have the broad scope that Manitoba LPNs have. So Manitoba LPNs work autonomously. This means that they do not work under the direction of a physician, registered nurse, or registered psychiatric nurse. They work with clients that have complex, unstable, and unpredictable conditions. They work with clients across the entire lifespan. So, for example, from newborns all the way to geriatric. And they work in all areas of practice, such as emergency, maternity, medicine, surgery, critical care, and long-term care. It's very important to note that the Manitoba pathway provides you with the best opportunity for success. It assists you with integrating into the Manitoba healthcare workforce by preparing you to manage the full scope of practice as an LPN in Manitoba. The first part of the process towards registration as an LPN in Manitoba involves applying to the National Nursing Assessment Service. We suggest that you visit their website at www.nnas.ca for detailed information about their application process. However, in the next slides, I will provide some information about NNAS and then discuss the application process with the CLPNM. The CLPNM uses a fair approach by considering each applicant as a unique individual. While we have a standardized process, it is not one size fits all. The CLPNM works hard to ensure that we use a fair and reasonable approach while following the LPN Act, regulations, bylaws, policies, and the Fair Registration Practices Act. As no one applicant is the same, we encourage you to contact the CLPNM for accurate information regarding your specific application process. In today's presentation, I will walk you through the IEN application process towards obtaining registration as an LPN with the CLPNM. We will discuss the following steps in the application process. So first, the National Nursing Assessment Service, then opening a file with the CLPNM, the Clinical Competence Assessment, Bridging Education, Practical Nursing Qualification and Recognition Program, and the Supervised Student Internationally Educated Nurse Gap Training Program, Graduate Practical Nurse Registration and the Canadian Practical Nurse Registration Exam, and then finally, Licensed Practical Nurse Registration. So step 1 is to apply to the National Nursing Assessment Service. While you're in the process of applying and completing your application with NNAS, you can begin the application process with the CLPNM. This means that you can apply to the CLPNM before NNAS has completed the review of your application and issued your advisory report. The NNAS provides an expedited process for CLPNM. This means that your NNAS advisory report will be issued within 5 business days of all documents being received. This service, the expedited service, applies to all current and new NNAS applicants who identify CLPNM in their application. So once the CLPNM receives your advisory report, it must provide evidence that you have graduated from an entry-level nursing education program. So that's the requirement that's necessary for being eligible to apply to us. Step 2 is to apply to the CLPNM. So our application process is completed online, and you must submit 2 forms of valid government ID, one with photo, and submit 3 suitability checks that are within 6 months from date of issue. These 3 suitability checks are a criminal record check with vulnerable sector search, a child abuse registry check, and an adult abuse registry check. You can upload your government ID and your suitability checks directly into your online application. You must also answer questions about your education, registration, work experience, answer some disclosure questions, and then pay the application fee. So once you have completed your application and it has been reviewed, we will refer you for a clinical competence assessment. To expedite your process, you may still be referred for a CCA prior to the CLPNM receiving your NNAS advisory report. Please note that immigration status is not required to open an application file with the CLPNM. In addition, while proof of language proficiency is required, it is not required to open a file with the CLPNM, nor to be referred for a clinical competence assessment. Step 3 is the clinical competence assessment. So once you have completed your online application and paid, and we have reviewed your file, you will be referred for a clinical competence assessment. The clinical competence assessment measures your nursing competence, including your ability to make sound clinical judgments in a variety of clinical situations. When you are referred for a CCA, the CLPNM will email you a referral letter along with 2 LPN CCA applicant guides. These guides provide information from how to book a CCA to what is included in the CCA. And the reason for 2 is because our CCA is at both Université de Saint-Boniface and University of Manitoba. The CCA at Université de Saint-Boniface includes a self-assessment that must be completed prior to assessment day. On the actual day of your assessment, the CCA at USB includes objective structured clinical examinations, a pharmacology knowledge test and a dosage calculation test, clinical judgments across the lifespan, and nursing care planning. The CCA at U of Manitoba includes safe Medicaid dosage calculation modules and exam, a written multiple choice exam, objective structured clinical evaluations, and clinical judgment scenarios. The CCA timelines vary slightly per the CCA conducted at USB versus the CCA conducted at U of M. The CCA at USB is 1 day, so approximately 8 hours. The CCA at U of M is over the course of 2 separate days. On day 1, you are required to write 2 exams. You are provided 2.5 hours to complete the multiple choice exam and 1.5 hours to complete the safe Medicaid dosage calculation exam. Day 2 is comprised of the objective structured clinical evaluations and the clinical judgment scenarios. If your CCA results show that you are not eligible to be referred to either GAP, bridging, and/or refresher education, you will be referred for a second CCA. If unsuccessful on the second CCA, the CLPNM's executive director may refer you for a third and final CCA. Please note that you must wait a minimum of 45 days between CCAs. Once you have completed your clinical competence assessment, the CLPNM will assess the results. So step 4 is the outcome of your CCA, which varies per applicant. Your next steps depend on if you were able to fully demonstrate the entry-level competencies of an LPN in Manitoba, partially demonstrate the competencies, or if you were unable to demonstrate the competencies. Most of our applicants demonstrate some of the entry-level competencies. So outcomes for this category usually include education, which may include a referral for GAP training, to bridging education, or to some foundational education that will prepare you for bridging education. Once you're ready to be referred to education, this is when evidence of language proficiency is required. You can provide proof of language proficiency by meeting the required scores from a board-approved language proficiency test. English language proficiency tests that are board-approved include the academic IELTS, the official CELBAN, the occupational English test, and the Pearson Test of English Academic. If you are a French speaker, the CLPNM also accepts the board-approved French language proficiency test called TEF Canada. The CLPNM also accepts the academic IELTS one skill retake test. So if you meet the required language cut scores in 3 of the 4 skill areas on the academic IELTS, instead of repeating the entire test over again, you can retake one skill only. While you can choose to take a language proficiency test, the CLPNM has introduced some alternatives to taking a language test. Another way that you can provide proof of language proficiency to the CLPNM is through an employer language attestation. In order to qualify for this alternative to testing, you must be employed in a healthcare setting by a specific Manitoba employer. The CLPNM has developed a form that you can provide to your employer, which is currently available upon request. For more information about alternatives to taking a language test in order to provide proof of language proficiency, we ask that you please visit our website at www.clpnm.ca and review our language policy. One outcome of the clinical competence assessment is that you may be referred to what is called the Supervised Student IEN or SIEN GAP training program. The SIEN program has been established with specific Manitoba employers to provide IENs who are deemed eligible by the CLPNM the opportunity to be employed and work in a supervised capacity for an eligible Manitoba employer under the supervision of another regulated nurse, so a licensed practical nurse, a registered nurse, or a registered psychiatric nurse, while completing bridging education requirements. This program also offers you the ability to gain exposure to the Canadian healthcare system and to Canadian healthcare culture in an environment where you would have access to support from other nurses. You would also be given time away from work in order to participate in required education. And you would be able to complete the required supervised clinical experience through paid student IEN employment. This means that you would not be required to complete a separate clinical practicum through an educational institution. Another outcome of the clinical competence assessment is that you may be referred to all or some of the courses in our practical nursing qualification recognition program. This 18-week program at Assiniboine Community College includes courses that are face-to-face, online, and includes clinical practicums and exam preparation for the Canadian Practical Nurse Registration exam. Not everyone that's referred to the PNQR program must take the entire program. Courses that you are referred to are selected based on your individual CCA assessment. So this means that while some applicants will be required to take the full program, others may only be required to take 1 or 2 courses. Individuals who have deeper and broader gaps may also be referred to some foundational courses. These foundational courses will help support their success in the PNQR program. If you have been referred to the SIEN Gap Training Program, you will take the required courses that you have been referred to through the PNQR program and or through continuing education at Assiniboine Community College. Your employer will give you time off work to join a cohort for your required PNQR classes. Once you have completed your course of instruction, the CLPNM receives a transcript from Assiniboine Community College. For those in the SIEN Gap Training Program, we receive a transcript and an employer evaluation form confirming satisfactory completion of your required practice hours. We then review your entire file and email you correspondence with information regarding your next steps. Step 5 is to apply for graduate practical nurse registration and to sit the Canadian Practical Nurse Registration exam. Once you have demonstrated that you meet the entry-level competencies of a licensed practical nurse in Manitoba, you can apply for and obtain graduate practical nurse registration while you wait to write the Canadian Practical Nurse Registration exam. Please note that if you did not complete CLPNM's jurisprudence requirement while taking your bridging education, it must also be completed prior to applying for graduate practical nurse registration and applying to sit the exam. Prior to the CLPNM processing your graduate practical nurse registration, you are required to go to the Canadian Nurses Protective Society, or CNPS, at cnps.ca and join to obtain professional liability and course services. Once you are a graduate practical nurse, you are expected to write the CPNRE as soon as you have been directed to do so by the CLPNM. The CPNRE is computer-based and virtually proctored, so it can be taken anywhere, even at your home. It is important to note that nearly all IENs who complete the process through the CLPNM, so this is the Manitoba pathway, pass on their first attempt of the CPNRE. Step 6. After successfully sitting the CPNRE, you can now apply to become a licensed practical nurse in Manitoba. You must apply and pay for initial enrollment and active practicing registration within 30 days from being notified that you have passed the exam, as GPN registration expires after 30 days. However, if you do not apply during this time, the CLPNM will allow up to an additional 60 days but you will not be able to work during this time because your GPN registration would have already expired. Once your registration as an LPN has been approved, you can view your status on our public registry. As an LPN, you are required to engage in the Continuing Competency Program and to annually renew your LPN registration. On this slide, I have provided you with some links specifically to our website, so at www.clpnm.ca, as well as to the Credential Assessment Application Guide for IEN, which is a guide that will walk you through the entire application process, and then links to both of our CCA guides for the CCA conducted at Université de St. Boniface and at University of Manitoba. Please note that the information presented today is subject to change. As such, you are always strongly encouraged to check our website or to contact us directly for current information. So here's our contact information. If you have any questions about applying to the CLPNM, or if you have any questions about your open application with us, you can either contact Gail Biawick, who's the administrative assistant, or you can contact me directly. And that's my presentation. Thank you very much.
Thank you so much, Kathy, for the informative presentation. Now we will move on to the CRPNM, and they will be presenting on the application process for IAPNs for nursing for registered psychiatric nursing in Manitoba. Over to you, Ryan.
Thank you, Ida. I'm going to share my screen. Hopefully you can see my presentation.
Yes, we can.
Perfect. I think I need to, how's that? Can you see the full presentation?
Yes, perfect.
Okay, perfect. Thank you. My presentation is going to be a bit shorter, simply because registered psychiatric nursing is a very distinct profession in Canada. Registered psychiatric nurses are not regulated in a lot of countries around the world. We typically are regulated in British Commonwealth countries. So, for example, the UK, we receive a lot of applicants from India and Nigeria and the UK. So those are our kind of three primary source countries. So just to clarify that we have three distinct nursing regulatory bodies in Manitoba. So you already heard from Kat on behalf of the LPN profession. We have registered nurses, and then we have registered psychiatric nurses. Each have different requirements for registration and different education programs. We want to ensure that applicants apply to the college that best fits their competencies so that they don't waste your time or your money going to the wrong door. So one of the questions that I usually receive, and it's usually from registered nurses who work in mental health, is, well, can I apply to the College of Registered Psychiatric Nurses because I'm a mental health nurse? So one of the things that we would do is I would take a look to see whether you meet the requirements, and I'll get to those as we go on. But the answer that I always give to people is that you can still work in mental health as a licensed practical nurse or as a registered nurse. The difference is that you may not be able to register as a registered psychiatric nurse because our competencies and our requirements are different than that of an RN or an LPN. So who can apply as an internationally educated psychiatric nurse? Anyone who's educated as a registered psychiatric nurse or a psychiatric nurse in their home country outside of Canada. You must be currently registered or eligible to register, so that's having graduated from a psychiatric nursing program as an RPN in your country of practice. And so I already spoke a little bit about this. RNs with a specialization in mental health may or may not qualify depending on the education program in which you received your education. So it really depends on how you were trained and what your training program looked like. So these are our requirements for registration as a registered psychiatric nurse. So I always encourage people to take a look at their own programs to see whether you meet these requirements. So we have to have 500 hours of theoretical knowledge related to the development of psychiatric nursing competencies. So that is centers around the therapeutic relationship and the development of the therapeutic relationship. Psychosocial interventions. So for example, the interventions that we provide as registered psychiatric nurses. So maybe it's cognitive behavioral therapy, maybe it's dialectical behavior therapy, maybe it's something else in terms of psychosocial intervention. Mental health and mental illness, so an understanding of the diagnoses and the DSM. So that's the major nomenclature that we use is the DSM. Psychiatric medication, so a specific course in psychopharmacology, and psychiatric nursing ethics. So one of the other requirements is that you have to have a minimum of 225 hours related to the development of general nursing competencies. So these are your foundational concepts, so nursing fundamentals or fundamentals of nursing. I'm sure many of you have taken those types of courses. A dedicated health assessment course, dedicated pathophysiology course, diagnostic methods, treatment approaches, a medical surgical nursing course, and then care planning. So we do accept other coursework that may be utilized to meet parts of the requirements. So for example, life sciences, so that's like intro philosophy, those types of courses, research methods and statistics, psychology, so an intro psychology course or psychology courses that you've taken beyond intro psychology, sociology, and then women's studies, for example. So this is the big piece that I tend to find that people tend to struggle with in terms of whether they meet the competencies of the psychiatric nursing profession. So the big piece is that we require a minimum of 1,000 clinical practice hours. And those clinical hours must include a minimum of 775 clinical hours in psychiatric nursing, which means that those have to be dedicated hours in a psychiatric nursing environment. So acute care psychiatry, potentially long-term care, community mental health. It has to be dedicated to a psychiatric nursing environment where psychiatric nurses would work. And then we need a minimum of 225 clinical hours in general nursing, which I would say the great majority of people who apply to us meet those clinical requirements unless you were trained in the United Kingdom. What we have found is that nurses who are trained in the UK do not generally meet the clinical hours in general nursing. So if you determine that you are eligible or you feel that you're eligible to be employed as a registered psychiatric nurse and to apply to our college, you'll need to go through the process of NNAS. I'm sure many of you have probably already started your NNAS process, but if you haven't, the link is here. Your NNAS file must be completed before you can start your application with our college. So once the NNAS report is done, you have an ID number and so you'll have two numbers. You'll have your identification number through NNAS and then an application number. We need both of those numbers in order for you to open a file with our college. So if you decide that you're going to apply to the College of Registered Psychiatric Nurses, this is what you will require. This is what we require. You'll need your online application. So the link is there in the presentation. You'll need your application fee. You'll need the proof of identification, so birth certificate, photo ID, name change document, passport, those types of things. A criminal record check with a vulnerable sector search. So that's for those people who are already living in Manitoba. Child and adult abuse registry check. So again, if you're a Manitoba resident, if you're applying from the country that you last worked in, then we just need the criminal record check from the country in which you were last registered. We'll need a confirmation of registration form. So that comes from your previous employer, your previous licensing body, an employer reference, and then as Kat already discussed, the proof of English language ability. Our requirements are a little bit different for English language ability than the CLPNM. It's a lot to explain. So if you determine that you are eligible or you feel that you're eligible to apply with the College of Registered Psychiatric Nurses, I encourage you to give me a call. But as long as you have taken a program in English, we consider that to be proof of English language ability. So we have very few applicants who are required to submit an English language proficiency test. So again, this is what we typically think of, or this is what we think of. I have to change this slide, but we determine that English is your first language. If it's the language that you learned in childhood and you use it in a program. So if you studied in a program that was taught in English, we would consider that to be proficient. I haven't updated the tests, CELBAN and IELTS, as well as the CLPNM. We also accept the Pearson test, and we accept the OET. So we actually accept 4 tests. The one test that we do not accept is the TEF, because we do not accept a French language test. It has to be completed in English. So once your documents are completed and you've applied to the college, we have your NNAS report. I conduct an education assessment. And so we approve entry-level psychiatric nursing programs based on the education requirements. So where you studied, the program that you took, and the competencies that you gained from that program. The education assessment for us is generally completed in 4 to 6 weeks. Sometimes I can get it done a little bit sooner. But I'm the one who conducts it. And so it really depends on how many we have in and how many I need to assess. Once we've completed it, I notify everyone by email. And so you would receive an email letting you know that, and I provide a letter that outlines what you need to do in order to register. So a lot of times there's bridging that's required. We have 2 bridging programs, and I'll talk a little bit about that on the next slide. But we would let you know what you need to complete in order to be eligible for registration. So some potential outcomes, if you are comparable, you automatically are granted eligibility to write our national exam. We get very few applicants that would be comparable. Typically where we've seen people who are comparable is applicants from the United Kingdom that have trained and taken a psychiatric nursing program in the UK, and then they've done some form of medical surgical nursing in some form in their practice. Other people that we've deemed to be comparable are typically applicants that come from India that have completed a master's of psychiatric nursing program. So they've done their baccalaureate program as a registered nurse. They might have taken a psychiatric nursing program in India, and then they go and complete their master's of psychiatric nursing. Somewhat comparable, most of our applicants end up in this cohort. That means that there's some gaps that are identified and you will need some remediation. We have 2 programs. So we have one program through Douglas College in British Columbia. It's all by distance. So we allow our applicants to take that, or you can work with an individual consultant by the name of John Collins. And I would say more of our applicants tend to work with John Collins than they do through the Douglas College program, just because John provides a one-to-one kind of assessment, one-to-one learning, and people have said that they found it a little bit more comprehensive than the Douglas College. If we determine that you're not comparable, you have to complete a basic education program in psychiatric nursing. So I do receive a lot of calls and queries from nurses who've trained in the Philippines. Filipino nurses generally do not meet our basic education program requirements because the Philippines does not have a dedicated psychiatric nursing education program. So the registration process can take, it can vary in the length of time to complete. I've seen people come through in as short as 1.5 years from applying to NNAS and then applying and completing their application process to the college. The length of time really depends on how quickly you receive your NNAS report. Once people get their NNAS report and they apply to us, it actually is a pretty short process from when I complete my assessment to when you receive my letter saying that either you can register for the exam or you're somewhat comparable and you need to take bridging. As Kat said, just as it sits with the LPNs, you might be eligible for graduate psychiatric nursing registration while you wait to write the exam. So typically for people who fall in the somewhat comparable, they finish their bridging and then they can go on to our graduate psychiatric nurse register and work until they write the exam. And then once you pass the exam, full registration to the RPN register is granted. So that's pretty much our process in a nutshell. As I said, it would be really quick and really simple, just because I find that not a lot of people are qualified as a registered psychiatric nurse in their home country. But if you are, I'm probably going to guess that you've already started your process and you're already working with Manitoba Start to work on some of those other pieces. But if you do have questions or you do have comments, or if you're not sure whether you might fit, you are always welcome to contact me at any of the numbers that we've put there, or my email address is there as well. So if you have general questions or comments, by all means, feel free to reach out to me and I will try to answer your questions.
Thank you so much, Ryan and Kathy, for the informative presentations. Now we will open it up to the audience. Do we have any questions? Again, please type your questions in the question panel box or raise your hand and we will unmute you so you can ask your question. We welcome both English and French questions and we will try to get through as many as time permits.
Alors, est-ce que nous avons des questions? Encore une fois, veuillez taper vos questions sur le panneau de questions-réponses ou lever la main et nous réactiverons votre micro pour poser votre question. Nous essaierons d'en traiter autant que le temps le permettra.
Thank you so much. And there is a question in the Q&A panel. I'm going to read it to you. Is prior work experience as a nurse in another country considered during the recognition process?
Hi, this is Kathy from CLPNM. Yes, we consider work experience, education, and then the information that's provided in your NNAS advisory report to conduct our review of your file. It's not necessary though. So to apply to the CLPNM, you don't even have to hold registration in the country where you obtained your entry-level nursing education or in any other country. You only have to have graduated from an entry-level nursing program to be eligible to apply.
And for us, work experience is somewhat, I would say it's somewhat considered. We don't directly consider work experience towards your application, but it is considered in terms of the number of hours that you've worked as a registered psychiatric nurse. And so that has an impact, like Kat said, through the NNAS report, in terms of maybe some of the gaps or the gap training that might be required. So we don't directly assess work experience, but it is included in terms of the number of hours that you've worked, those types of things.
Thank you so much. And are there any Canadian work experience requirements before obtaining licensure?
Not for the LPNs.
And not
if you're
for us either.
applying, sorry, I should say,
go
if
ahead,
you're
Kat.
applying to us, sorry, Ryan. If you're applying to us as an internationally educated nurse, then no, the Canadian hours are not required. If you're applying to us a different way, so for example, as an endorsement applicant, then 1,000 hours are required.
Thank you. And are there any more questions? If you have questions, please write your, oh, there is a hand. Dushel, I'm going to unmute you so you can ask your question. You will be self-muted. So if you can unmute yourself.
Hi.
Hi.
It's just that I thought that to apply for NNAS, we need to prove a high card in the English test. Because my first language is French. So I think at English test, Serban, it was not very good. with hello.
Hi, Duchelle. So this is Kathy from the College of LPNs. So no, to apply to NNAS, you do not require to take language. So NNAS no longer collects language proficiency, so you can apply without that. If you chose to apply as an IEN to CLPNM, you would have the option if you wanted, if your first language is French, you would have the option of taking the TEF Canada, which is a French language test to prove your language proficiency. The only thing that we tell people, though, is that our clinical competence assessment and our bridging education is only provided in English. So it's important that you do have a high level of English language proficiency in order to succeed throughout the pathway.
So I have to take a English class to make a level help to my English before to apply to CLP.
Where are you living?
I'm
Are you in
Manitoba.
Winnipeg?
Yeah.
Okay, so you can contact me and I can provide you with a list of different options to take English language classes.
I already I contact the registered nurse for English, college registered nurse for English, my English class 3 months ago, but nothing. He said that I have to wait.
Okay, well, we're the College of Licensed Practical Nurses, so I'm not sure what information you were given, but you're more than welcome to email me directly and I can provide you with some information about English classes.
Thank you so much, Kathy, for the answer. Do we have any more questions? I guess that's the end of the questions, and I will share my screen. If you are not currently a Manitoba Start client, you can call our front desk, visit in person, or complete our online registration form that is on our website under For Newcomers tab, Register for Services. As you can see here you can see if you're eligible, and here you can click on this button to register online. By registering with Manitoba Start, you will connect with settlement services and have access to the career services that can assist you with resume development, career planning, job search strategies, and interview skills. For a list of programs and services offered by Career Services, go under the Career Services tab. As you can see, we offer lots of workshops and resources here. Lastly, please take a look at our events page to stay up to date on our latest events and webinars. And if you miss a webinar, we have webinar recordings under events. If you miss a webinar, you can come back and rewatch them.
Et si vous souhaitez être connecté à la communauté francophone pour obtenir du soutien à l'établissement ou à l'emploi, veuillez contacter EDA. J'espère que vous avez trouvé cela utile. Merci.
Don't forget that Manitoba Start is here to assist you by providing services such as personalized career coaching, developing your resume, or job search assistance to find you sustainable employment. Please follow us on social media to stay up to date on our latest events. So on behalf of Kathy and Ryan and the Manitoba Start team, thank you for attending and stay well.
Thank you, everyone.
Thank you very much. Take care.